marathon runner runs a race and they finish and they get to rest. It's been an 18-month-long race and we're not done.
Baptist Health continuing the long fight against COVID-19 and adding more ICU beds at 2 campuses in the state. Good evening and thanks for joining us. I'm Kevin Kelly.
I'm Donna Terrell. This comes at a crucial time. At one point today, Governor Asa Hutchinson saying there were no ICU beds in the entire state. Jessica Rank following the story for us tonight, joining us live outside Baptist Health Hospital.
Yeah, so Jessica, what's the hospital's plan moving forward, and when are these extra beds going to be available?
Yeah, Kevin, well, Baptist Health says they plan on adding 18 ICU beds by Friday. Now, 10 of those are supposed to go to the North Little Rock campus and the rest of them over to Fort Smith. Now, they say they have all the equipment for the beds, and all they need now is the nurses to staff them. As each day passes, more filter in through the doors of Baptist Health. But fewer are being discharged.
It is an urgent time.
Major hospitals across Arkansas are now scrambling to try and get more beds as COVID-19 hospitalizations rise.
I don't know of any more dire time in the state and the need for critical care in my 27 years than right now.
Tuesday, Baptist Health answering the call. They will be adding 18 ICU beds in the coming days in North Little Rock and Fort Smith. Of those, 15 will be dedicated solely to care for those with COVID-19. And the extra beds come at a crucial time. The state reporting at one point Tuesday, there were no COVID ICU beds available.
There has been planning and there has been those steps taken, and thank goodness we took those steps.
But before they can put patients in beds,
none of us want to be in a hospital bed where there's nobody there.
They have to get the right number of staff. Greg Crane with Baptist Health says they'll be calling nurses from outside the state to lend a hand.
Those 18 beds are dependent on that staff showing up.
Crane says the solution is temporary.
There will become an end where there won't be any more what's next.
And the real fix will come when more decide to sit down and roll up their sleeves. Now, the hospital says they're pretty confident they can get those doctors and nurses here in the coming days, but this additional ICU beds come just a few days after the hospital also added more than 150 beds for non-ICU COVID patients. Live outside of Baptist Health, I'm Jessica Rank for Fox 16 News.